Welcome, future nurses! In this lesson, we'll walk through essential nursing care for women experiencing postpartum complications. This includes hemorrhage, infections, thromboembolic disease, hematomas, urinary tract infections, mastitis, and mental health concerns like postpartum depression and psychosis. Let's dive in. Postpartum hemorrhage, or PPH, is defined as blood loss greater than 500 milliliters after a vaginal birth or more than 1,000 milliliters after a cesarean. There are two types. Primary PPH occurs within the first 24 hours and is the most common. It's usually caused by uterine atony, trauma, or retained placenta. Secondary PPH happens between 24 hours and 6 weeks postpartum. This is often due to retained placental fragments, infection, or subinvolution of the uterus. PPH is the leading cause of maternal death globally, making early recognition and prompt treatment vital. Be alert for women with retained placenta, prolonged labor, placenta accreta, lacerations, large babies, instrumental delivery, hypertension, uterine overdistension, obesity, or a history of cesarean delivery or stillbirth. Look for heavy vaginal bleeding, continuous trickling, large clots, a boggy uterus, bright red bleeding after it previously turned lighter, cool or clammy skin, and vital signs showing tachycardia or low blood pressure. Start with fundal massage, but always support the lower uterine segment and never over-massage. Call for help immediately. Weigh pads and linens. Remember, 1 gram equals 1 milliliter of blood. Insert a Foley catheter if needed. Start for fluids, administer oxygen, elevate the legs, and provide emotional support to the family. Use oxytocin first line. Alternatives include methylergonovine, but not in hypertensive patients, carbaprost for resistant cases, and misoprostol rectally. These may include bimanual compression, dilation and curettage, vessel ligation, or hysterectomy. Use O-negative blood in emergencies. Follow up with a type and crossmatch for further transfusion. Hematomas are localized collections of blood, typically in the vaginal or vulvar area, often due to trauma. Common signs include intense pain, visible swelling, and difficulty urinating. Turn the patient to assess. If under 3 to 5 centimeters, treat with ice every 2 hours and warm sitz baths. If larger than 5 centimeters, surgical drainage may be needed. Always monitor vital signs and offer reassurance. Endometritis is infection of the uterine lining and can follow prolonged labor, ruptured membranes, caesarean birth, or frequent vaginal exams. Symptoms include fever over 100.4 degrees Fahrenheit for 2 days, foul smelling or scant lochia, and abdominal pain. Expect pelvic exams, blood cultures, and for antibiotics. Nurses provide fluids, pain relief, education, and support bonding, and breastfeeding. Wound infections may occur at episiotomy sites, lacerations, or caesarean incisions. Look for redness, heat, pain, drainage, or fever. Take cultures, administer antibiotics, encourage nutrition and hydration, and educate on hygiene. UTIs are common postpartum, especially after catheter use. Symptoms include urgency, burning, fever, and small amounts of urine. Encourage fluid intake, administer antibiotics, and reinforce hygiene, wipe front to back, and use the Piri bottle after voiding. Sepsis is a life-threatening complication. Warning signs include fever or low temp, chills, fast heart rate, rapid breathing, vomiting, low urine output, and confusion. Act fast. Mastitis is a painful infection in the breast, typically caused by staph from baby's mouth or mom's skin. Symptoms include a red, wedge-shaped area on one breast, pain, fever, and swollen lymph nodes. Teach good hygiene, correct latching, and encourage breastfeeding to keep milk flowing. Apply warm compresses, provide antibiotics and pain relief, and reassure moms that it's safe to continue breastfeeding. Blood clots, especially DVTs, are a serious postpartum risk due to sluggish blood flow and vessel injury. If a clot travels to the lungs, it can cause a pulmonary embolism, which is an emergency. Sudden shortness of breath, chest pain, and coughing. Treat with heparin, warfarin, or enoxaparin, and monitor labs closely. Prevention includes early ambulation and compression devices. Postpartum depression is more severe than the baby blues. It affects 10 to 15% of mothers and interferes with bonding and daily care. Include a history of depression, stress, lack of support, and unplanned pregnancy. Persistent sadness, irritability, fatigue, appetite changes, and thoughts of harm to self or baby. Always assess safety. Includes SSRIs, therapy, and emotional support. Early intervention is critical for both mom and baby. PPP is the most severe postpartum mental health condition and a psychiatric emergency. Symptoms start within 48 to 72 hours postpartum and may include paranoia, incoherent speech, and hallucinations. Include bipolar disorder or previous PPP episodes. Recognize warning signs, restlessness, odd behavior, paranoia. Ensure safety and arrange immediate psychiatric care. This is not something that can wait. You've just reviewed the most critical postpartum complications you'll encounter as a nurse. With your clinical knowledge, quick thinking, and compassionate care, you can make a life-saving difference for new mothers. Keep learning, keep growing, and thank you for choosing nursing.